Pancreas. That sounds so far-fetched, but for folks, it's happening for people with type 1 diabetes. Type 1 is when the pancreas stops producing insulin. UVA researchers just completed a clinical study that could eventually mean no more daily injections of insulin for patients. I spoke with a UVA diabetes researcher about this trial. As shown in this diagram by the University of Virginia, the artificial pancreas is produced from a reconfigured smartphone shown in the boy's right hand. It's wirelessly linked to a blood sugar monitor and insulin pump that's worn by the patient. The cell phone allows the two to talk to each other and to automatically calculate how much insulin is needed.
And it tells the pump how many units of insulin the patient needs at a specific moment, either for what they are eating. Even if they miscalculate the amount of carbs, the system will compensate for that miscalculation.
And that's so important to a type 1 patient who no longer has a working pancreas to control high or low blood sugar levels. That can be extremely dangerous. Patient Laura Sivright got to try the artificial pancreas out in a trial for 5 weeks.
I was able to sleep through the night without worrying about, am I going to leave my parents on this earth because I pass away in my sleep from a low blood sugar at night?
That's the worry type 1 patients have, and researchers say this breakthrough is a game changer.
That won't have dangerous hyperglycemia or dangerous low blood glucose. It will keep them in range. More importantly, if they start doing this during childhood, they will avoid complications later in life.
The study showed the artificial pancreas successfully kept the patient's blood sugar levels in the target range. Now, it's not the first one to be created. Another recently hit the market. This one will hopefully be available by the end of next year.
Unexpected tragedy for the family of